Okay, guys, Total Control 871. Here at the hospital after being placed under extreme distress for not smothering myself. I do my best to accommodate their make pretend pandemic. Explain to me so the difference between this and this is a rubber band. Okay, there's this, and then there's this. What's the difference? Okay. Why is it that there were people in Walmart who were walking around with all manner of fabrics covering their face? Um, what I want to talk about was that I don't know if the camera was cutting out on me, so there are portions of this thing that didn't record. I'll know on review as to what made it into the cut and what did not. Okay. Um, Here at the hospital, they're saying that they will not treat me unless I wear this mask. They're not. There's no oxygen. There's nothing coming out of this. They keep telling me that there's nothing. If there was a Dixie cup, I would fill it with water and submerge this in it to prove that there's no oxygen coming out of it. So this is just being done. This is all theater. Um, they're saying that my oxygen is practically 100%. Well, yeah, I guess it is now. Now that I'm not smothering myself. What we saw was that you're going to be turned away at hospitals for your actual disability if you're not able to cover your face the way I'm not. They have closed the door to create some kind of make pretend what quarantine ward. Um, all theater, all show. They're gonna call me. You see, they left the blood pressure cuff on me. These are people who don't care. It was inflated too. They didn't. So we are seeing. I was going to put this in an episode. I really was. It's just a matter of time. I mean, you can even stop using the if you don't like the terminology mark of the beast, if that's too biblical, too spiritual, fine, whatever. But we're seeing that the very basic fundamentals of life are being stripped away. Okay, where the healthy get quarantined. They talk about you're going. We saw in our first part. You're threatening people's lives. If people are so frail that they can't come out of their homes, then that's what they should do. They should stay home. Why does all of society have to grind to a halt? Okay. The medical staff had nothing but contempt for me. Because they don't acknowledge their fake pandemic. Um, so that means I'm not going to get any medical care. Um, I'm in the cooler. The ambulance's air conditioning helped a great deal. Um, I never did get my cooling note. I never did make it to my doctors or my cardiologist or anything like that. And we see, I don't know if it cut off or not, before the ambulance departed from Walmart. I was advised that I had a 2-year trespass on Walmart. I'm going to return to Walmart because it's the only place that I can afford to shop. Okay? There I will be met by police. There I will not leave willingly. They will physically assault me. They will draw their weapons. I will be shot and killed. Yes.
How you doing, man? You alright?
No, I'm not.
What seems to be the problem?
Who are you?
First, I'm not going to talk to you while you're recording here. I do not consent to that recording. So if you shut your phone off, then I'll talk to you.
Okay, so you're a security officer.
I am security. I'm going to talk to you once you shut your phone off from me, please. It's not shut off, sir. I do not consent to that recording, sir. I'm going to ask that you turn your phone off, please. And then I will have a conversation with you.
How do I know you won't hurt me?
Sir, you know I'm not here to hurt you. I'm going to ask that you turn your phone off, please.
No.
So I'm asking you to turn your phone off.
No, I want to see exactly what you're going to do to me.
I'm going to have a conversation with you, sir.
Please, by all means.
I do not consent to this recording. Can you take me off the... Thank you. And can you turn your phone off?
I'm going to keep myself recorded in case you try to hurt me.
We do not consent to the recording. I'm not going to hurt you. No one's going to hurt you in this hospital. That's not what we're here for. We're here to take care
I have been hurt in hospitals.
But not this hospital.
Yeah, they're all the same. Atlantic Care, it's all
They're
the same.
not the same, sir.
Yes, yes.
They're not the same.
Were you aware that I was threatened to be raped with a catheter?
I have not been.
Of course not. You don't care.
It's not that I don't care. But
Chris Cantino, a psych nurse, threatened to rape me.
Did that happen today?
Oh, so you're saying that the allegation, there you go, people. I guess, I don't qualify for a Me Too, so.
That's neither here nor there. That has nothing to do with right now, what's going on right now. I'm here to talk to you about your state today, not what happened in the past. All right? If something like that happened in the past, you should make a complaint with the police department.
I'm here for medical care, not security.
All right, so I'm going to ask that you turn your phone off so that way we can have a conversation.
You're not a medical professional.
I'm not here to talk to you about anything medical or anything about
Then
your
leave.
state. I have a security reason right now, so I'm going to ask you to turn your phone off.
What is your security reason?
You do not have a mask on, sir, and I'm asking you to put your mask on. But
I cannot breathe with this
I will
mask.
not continue this conversation with your phone on, sir.
He's about to become physical.
I'm not. There's no need for me to be
So
physical.
now we see exactly why there needs to be recording.
There's no need for me to put my hands
Okay,
on
I will tell you this.
You're not threatening anybody. You're not putting your hands on anybody. I need to have a conversation with you.
Did he just say, he told me that he's perceiving me as being threatening.
I said you're not threatening anybody and you're not putting your hands on
What
anybody.
would prompt you to say that?
There's no need for me, because you said that I'm going to hurt you in some way. I said there's no need for me
You
to do
said
that.
you're not. You said you're not.
Sir, you're not going to twist my words around. I know exactly what
So
I
if
said.
it was, then why didn't you say I'm not
I'm
going
not
to
here to go
hurt
back
anybody?
and forth with you, sir. If you want to get here,
Hello?
I need you to put your mask on, sir.
Can you turn the oxygen on? You or
I
somebody.
need you to put your mask on, sir.
Oxygen on, mask on.
You need the oxygen on, we can put the oxygen on if that'll help you. Your oxygen saturation is pretty good. What brought you into the hospital, sir? Why are you here?
He's recording me.
Why are you here, sir?
I tell you what, I will have a conversation with the doctor off the record if you leave.
Can I put this on for you?
Is there oxygen coming out of it? Dr. McBride, didn't I speak with you on the phone?
No.
No?
I just walked in the door.
No, not today. I'm saying I thought one of the
Maybe at some point, I don't know. Sometimes
on the
I
phone. I thought somebody had called me
Yeah, well,
on.
there. If you put the mask on, because that's the policy now, we don't want to be, putting anybody
Yeah, there you
at risk,
go.
including yourself.
Hold on. Oh, I'm sorry. I'm not a subscriber to your fake pandemic. So
Well, I didn't make it.
do I have to keep this on?
Here, we'll take that off for right now. Hopefully we'll all get through this soon enough and we won't have to wear this stuff anymore. I'm sick of it too. How you doing today? What brought you in?
Oh my God, it's nothing but hot.
I know,
How
very
the-
uncomfortable. I think I'll try wearing this thing. God, I can't even breathe. I got
There
you.
is nothing but hot carbon dioxide cupping in this thing.
I know.
Okay, well, I need some kind of a vent or something for the hot air to
Yeah, you need one of those that has a one-way valve.
well,
right?
whatever it is. All right. Now,
So what brought you in here, sir? I heard you were a little short of breath.
okay. Now, here's what happened. I am at Walmart.
Mm-hmm.
Went to do shopping. Didn't go to cause a scene.
Okay.
I am aware of KGB Comrade Murphy,
Mm-hmm.
our communist governor. His orders for face mask. I'm not even going to get into the whole
Yeah, that's not for us to
CDC
discuss.
says do it, don't do it, in a way all the data is constantly being edited day to suit an agenda.
I hear you.
We
We
will
can't
put
follow it either.
We'll put that to the side. Okay. Go to Walmart. God is my witness. Did not go to cause a scene. Not trying to elicit a lawsuit from Walmart or even this hospital.
Yeah.
I'm just somebody that wants to
You want to do your shopping?
do my shopping.
Okay.
Now, perhaps you can explain to me, being a medical professional, what is the difference of stopping the virus or spreading the virus between this, whatever it's made out of, and this? This is what I used. I cannot have this thing strapped to my face, okay?
Yeah.
I go in and I keep it covered like that.
Yeah.
There is because the governor himself, he was questioned on this in the press, maybe you know about it. Is there something specifically designated? Do we got a particular make, brand, or model of
Good
mask?
point.
What is
The answer is nobody knows.
nobody knows?
So you can wear that one?
He said nobody knows. So
Well, take that back. Not nobody. Somebody knows. but
somebody
nobody-
knows. I swear to
I
God,
know.
Dr. McBride, I'm not trying to
I know.
to bring you
I
or
don't
the
know.
hospital
I'll tell you,
into
I
a
don't know
lawsuit.
what particular mask is better than another. There's N95s, there's the regular ones. So to say what you're wearing versus something, nobody's done a scientific analysis of every mask.
And Dr. McBride, I
Mm-hmm.
think there's one of the security guards or whatnot that knows me from my bicycle riding. It might shock you to learn that I am an avid cyclist.
I remember you.
You know me, huh?
Oh, you got hurt or something. I remember this. I totally remember. I can't find any records of you, but I remember this.
I am an avid cyclist.
Yes.
Now, I don't know how much into the whole medical history you want me to go, but basically what's recently happened to me, I got hypogonadism type 2 that unfortunately has started to turn into type 1. Meaning, because you're a doctor, you know the difference between the two. The pituitary gland, master gland, not telling you other glands, all that stuff, which causes the morbid obesity. And now what's begin to happen is it's like if
I'll use this. Vitals are pretty good.
I'll use this analogy. It's like if a cute little 100-pound hot sexy mama came and jumped on you, wrapped her legs around you and whatnot. It might be fun and grand at the beginning, but eventually you're going to want her to get off.
Yeah.
What has happened to me when I finally reached 500 pounds from my disorder? It's like that last 100 pounds. I was very avid, very going on the bike.
Yeah, I remember this.
But it's only been this last, all of this, the stomach, this whole torso.
Yeah.
It's starting to turn into the whole apron thing with the the gastric surgery people and whatnot, and that's beginning to crush my genitals, which is now causing a hypogonadism type 1. So not only is the master gland no longer, so you got me.
Yeah.
So needless to say, it was that last 100 pounds that put the nail. I haven't been riding the bike like I have been, and then there's a whole economic element to it. I was homeless in the woods for several years. I just recently got housed this past August, which gave me a kitchen, which means that I can eat better healthy.
Yeah.
Which means I need to go to the market and do some shopping.
Some food.
So all of this is and there's more to it and stuff like that. But
Don't you have like a podcast or something? Or
yeah.
no?
Oh yeah, YouTube. I'm uploading right now.
I remember you so well.
I'm uploading right now
because I was advocating for you. I thought it was good stuff.
Well, thank you.
No, I'm serious. I thought it
Thank
was
you
good
so
stuff.
much. That made me feel so much better hearing
Well,
that.
you're doing good stuff. I remember talking to you about this stuff before.
Yeah, like I say, the thing is, and you know, I wish to God you get your instrument out. I want you to go up my nose. I want you to see with your own eyes how fucking twisted that septum is. Oh my God! Come on, you got to have a look.
All right, let me get a look here. Oh yeah. Oh yeah, it's bulging out.
That's what I'm saying, Doctor.
Oh, you know
I am
what? Are
only
you okay
five.
with an X-ray? Because I ordered an X-ray for you since you were short of breath.
Okay. Yeah, sure.
Let me get this guy in here and get this X-ray. Yeah. Come on in.
Because I'm
He's my
fired.
buddy. He does podcasts and stuff. He has a blog too.
I'm only firing with one nostril here.
Yeah, well that makes sense. Let me take a listen to you here, buddy. Are you short of breath now, or just when you're like walking around, or?
When this stuff is on
Yeah,
my face.
well, obviously. I
how-
cough more wearing
Put it
that.
like this. Put it like this. Put it like this. I used to have a multi-mile range on the bike
Yeah, I remember
where I
that.
could go, but all of a sudden with this last 100 pounds, this last I'll say maybe 6 or 7 or 8 months,
You're carrying another person with you.
it's like carrying another. And it's when I go out 2 miles out
Mm-hmm.
to one market. It's like I gotta sit down. I find myself suddenly having to take breaks. I never used to have to take breaks before.
Well, you're a little deconditioned.
And
Gotta get out on the motor, unfortunately.
and now it's like there's this. It could be anywhere from a dull ache to a sharp pain that shoots all the way through back to the back
All right.
ribs.
Well, we gotta get
There.
an EKG, get some cardiac follow-up. I want to make sure you're okay. Your vitals are actually beautiful. Your blood pressure's better than mine. I'm on 2 meds, and you're doing good. Let me get the X-ray. I'll be back.
All right, guys. So there you go. It's Dr. McBride. He knows me from the channel. Big shout out to Dr. McBride. Very nice guy. Very personable. We're gonna see if we can get a chest X-ray. There's a little oxygen coming out of this. It's not a lot, but the carbon dioxide that I'm expelling, it's being cupped in this mask and it has nowhere to go, and I'm sucking back in the carbon dioxide and of course the doctor didn't have, as we heard, there is no definition as to what constitutes a face mask and what does not. It just says face coverings, as Walmart's own sign said it. Alright guys, they're about to come in and do some chest x-raying. I'll kill this episode, this part right here, and I'll get back with you. I have to find my way home. I gotta get my way home. I lost my ride. Alright guys, that's it for now. Total Control 871.